Hello and welcome to the first part of our discourse on designing an evaluation, in which will focus on describing the program. At the end of this lecture, you should be able to explain why it is necessary to have a systematic process for describing a program, discuss the components involved in describing a program, detail the importance of a logic model in program evaluation. The participatory model we have described in this course identifies a four-step approach for ensuring a systematic evaluation. And these steps include design the evaluation, collect data, analyze and interpret the data, and then report the findings. In order to perform the first step, designing the evaluation, it is important that the program be well described and understood by each member of the evaluation team. So this lecture explains how to describe the public health initiative. In another lecture, we will explain the other task in designing an evaluation, that is how to identify the research question and specify the evaluation research design. Describing the initiative, its development, and its context allows stakeholders and the evaluation team to reach a common understanding so that appropriate research questions can be asked and answered. Stakeholders are critical in this process as they are likely to know the most about their programs. And this process is time consuming and it requires patience. It is important to get multiple perspectives as each stakeholder may view the program from a different standpoint. If the initiative has changed since the planning documents were written, chances are that the initiative being evaluated is significantly different. The importance of carefully describing a program to be evaluated is often not fully appreciated by new and seasoned evaluators alike. An initiative needs to be described for three reasons. First, describing the program provides evaluators with an understanding of the program's ability to produce the changes that are outlined in the goals and objectives. Secondly, clear descriptions of programs are required for meeting the program evaluation standards of utility and accuracy. Third, describing the initiative supports the development of recommendations at the end of the process. During this stage of designing the program is described in several ways by describing the context of the initiative, the justification for the initiative's goals, objectives, and activities, and the initiative's theory of change and logic model. The first component in understanding the organization's context is to understand its missions as contained in the mission statement. The mission statement defines in clear terms what the organization sets out to do. We've dealt on this in the previous lecture. The second component to understanding the organization's context is to understand the social, political, and economic climate in which it operates. This climate defines what the organization can and cannot do, and the level of support it has for the initiative it wants to offer. For example, in a low-income neighborhood with poor social and economic conditions, it may not be expedient to offer programs that may be politically unpopular. The economic context and therefore the current and past funding levels may shed light on the initiative's local and national support and its long-term sustainability. Other aspects of the organization's social, political, and economic climate include its budget, assets, and the resources available to it and to the community at large for addressing the problem. The third component of understanding the organization's context is to understand its structure. Generally, a non-profit organization has a board of directors and that oversees its programming and provides recommendations for the organization's direction. Public health agencies may have advisory bodies that provide recommendations. Other parts of an organizational structure are the staffing arrangements and the responsibilities of critical staff like the executive director and other directors and senior managers. So understanding staffing arrangements includes understanding work responsibilities and the time and effort in implementing the activities of the initiative. In order to understand an organization structure, the evaluation team can create an organizational chart showing lines of authority, as shown in the example on display. And the figure represents the structure of a non-profit organization that is overseen by a board of directors. The organization with 35 staff members has 5 funded initiatives. The executive director supervises 4 directors, one each for policy initiatives, finance, programs, and public relations. The Office of the Director of Finance has an accounts manager, and the program coordinator reports directly to the Director of Programs. The program and volunteer staff are supervised by the program coordinator. The fourth component to understanding the organization's context is to understand the initiative structure and its relationship to the organization. So, for example, if the initiative that is being evaluated is one of the 3 programs, then it is important to understand how they relate to each other, and specifically with regard to the staff time distribution, supervision, and funding. In addition, the team of evaluators studies the characteristics of the initiative that make it appropriate for addressing the problem, and the features of the initiative that address the particular needs of the population as defined by age, gender, ethnicity, and culture, and the training and preparation of the program staff and their capability to undertake the initiative. Additional questions may help evaluators make an informed decision about the initiative's merits, and these include how does the initiative reflect and build on the assets, the strengths, and attributes of the community, and to what extent is the intervention compatible with other programs within the organization, and to what extent does the intervention complement or build on existing programs, and to what extent does this initiative contribute to the community's overall public health goal. So in conducting an evaluation of an initiative, it is important to review ethical issues and issues of social justice. So evaluators should assess whether the program is developmentally and culturally appropriate for the intended population, assess whether the initiative is being delivered in a fair, equitable, and respectable manner, determine whether members of the intended population are involved in program planning and development. They should also determine whether members of the intended population are participating in the initiative, assess whether populations who could benefit from the initiative are being left out. And then the fifth component to understanding the organization's context is to understand how data are collected and how they are utilized to draw conclusions. Evaluators need to know the type of data and the quality and quantity of data and the level of sophistication of the data management systems. And the level of sophistication may range from simple, as a paper system with scratch pads for case histories, to sophisticated, in which all data are entered in a database by each member of staff of the organization. So the more advanced the system is, the more technically complex monitoring the organization can undertake. In justifying the initiative's development, the extent to which the public health problem affects sectors of the population and the factors that contribute to its existence at the individual, community, organizational and policy level are assessed. During this phase in describing the program, the administrators and staff are asked about the motivations for the program, and these justifications can sometimes be found in the organization's reports of community assessments or other documents. The results of the community assessments may be published in agency, local, state, or national reports, and may have been used for program or policy development. In addition to reviewing existing data and reports, the team conducts a review of epidemiological studies published in the scientific literature to determine the incidence, prevalence, morbidity, disability, and mortality rates associated with the problem in the nation, in the state, or in the community of interest. Such a review provides a means to compare the program being evaluated with others that are similar. And literature review also provides information on the social, cultural, and environmental conditions associated with the public health problem. It describes in narrative form the nature of the problem and those who are affected by it and why, how, and when they are affected. And it provides guidance for assessing the risk and protective factors associated with the problem at the individual, interpersonal, and environmental levels, and also the social determinants of health that influence the problem. As we mentioned in a previous lecture, the review of the scientific literature is part of the introduction in the final report for the evaluation. In addition to describing the justifications for the program, the evaluation team describes the expected effects of the intervention. These are stated as the initiative's goal and objectives, as we have described in the previous lecture. If there are no clearly defined objectives for the initiative, the evaluators must work with stakeholders to define expected outcomes for the program and formulate objectives that can be used for evaluation. The baseline for the objectives may be obtained from the description of similar initiatives in the literature or in reported research. And this search may also yield targets for the intervention. The Healthy People 2030 initiative provides national targets, while the Sustainable Development Goals 2030 provide international targets that may also be adopted. Without objectives, evaluators are in the dark regarding the targets for evaluation. The evaluation team describes also the initiative in terms of the perceived theory of change and the logic model. We have covered the theory of change and the logic model in the previous lecture, and so we won't go too much in detail about this, but the theory of change should be discussed with stakeholders to clarify understanding and allow for further input. It is important to evaluators for several reasons. Firstly, the logic model provides a shared understanding of the program. It is a tool for discussion among the diverse groups of stakeholders, and it clarifies the benchmarks and intended effects of the program. It documents program activities and program resources and provides opportunities to discuss strengths and weaknesses of program components. So the final step in describing the program is developing the program's logic model, which depicts its inputs or resources, the activities, the outputs, and outcomes in a graphic way. The figure on display is an example. It is a logic model for a program to train older adults as companions. The logic model provides the team with a shared understanding of the program components and forms the foundation for the development of the evaluation process. The logic model clearly articulates the program's theory of change, which may be tested in the evaluation. It provides a framework from which to identify evaluation questions. Logic models can be developed to support different aspects of the program and to suit different purposes. For example, if the initiative has multiple activities, then each set of activities can form the basis for an additional logic model depicting its resources and outputs, outcomes, and impact. During the developmental phases of a program, or when new components are added to an initiative, and the logic model may change. And it is important to revisit and update the initiative's logic model periodically so that it provides an accurate representation of the initiative being evaluated. In the complex world of public health, there may be a need to update the components represented in the logic model as the program matures and changes. In summary, describing the initiative provides an understanding of the social, cultural, economic, political, and structural context of the organization. And it supports the development of recommendations at the end of the process. And knowing a program's strengths and weaknesses allows the team to develop a feasible and useful evaluation. A thorough understanding of the program is achieved only from the multiple perspectives of the program's administrators and funders, staff, and advocates, as well as its current and past participants. A logic model provides a tool for stakeholders so that they can have a shared understanding of the initiative, can clarify the benchmarks, and can identify strengths and weaknesses. Goodbye and see you in the next lecture.